Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Thank you organizing committee for giving me the opportunity to brief and summarize my career as a medical doctor for MRSM Pengkalan Cepa 2024 Career Talk. I'm honored to share my experience of 30 years in government sector treating mainly public patients. I was brought up with a 4 siblings in a small town of a Kampung Machang by extraordinary parents to see their children's success in education. I still remember my nombor maktab, MRSM KB SPM 85 13181, and all my classmates aim for overseas secondary studies, but I decided to pursue my secondary study locally in medicine. I completed my 2 degree from UKM. At that time, UKM is in Hospital Kuala Lumpur, Chokit, for 5 years under JPA scholarships, and start working in Hospital Kota Baru until 1996. Then I joined specialist training as a out campus in 1996 and completed my board certified orthopedic in 2000. Worked in Hospital Kota Baru again as a specialist and orthopedic surgeon, and joined University Science Malaysia as a lecturer and surgeon in 2001. Medical career is widely diversified. You can choose whether to directly involve treating patients as a physicians or surgeons, or indirectly. This is bigger scope that contribute in planning, general treatment, as well as a well-being of patient management. You can choose either to become a researcher, basic science doctors, doing all blood study, investigation, pharmacology for drugs, as well as evaluation, diagnostic. It's either parasites, bacteria, and a lot more. And you can become a hospital manager, statistician, which is not directly involved with the patient. And if you think of becoming a politician, then this is one of the best career for you to success as a politician. After completed 3 years compulsory service as a medical officer, then I choose to become orthopedic surgeon to learn more in orthopedic surgery. It's all about bone, tissue, joint for locomotor, for the limbs. Actually, the things started way back when I was in MRSM PC. Physics and mathematics is one of my interests. Orthopedic is all about engineering, repair human being. It's all about biomechanics, physics, calculation, force, strain, curve, and modulus strength of an implant, as well as strength of a bone and joint. The things that fascinate me is when patient get fractured, he lost all the function. Then the whole idea of orthopedic surgery is to realign the bone and patient back to its own function after the bone stabilize. And even in very bad fractures, the patient also still can function very well. So you see, both upper part of a knee as well as lower part of a knee have a severe injury, and the patient still return to his normal activity and have their own function. In general, orthopedic is about motion. Life is motion, and motion is life. That's about orthopedic. Before 1990s, limb cancer in Malaysia end up with amputation and early spread to the organ, lung, as well as internal organ. And most of the patients succumb or died to the disease early. This is because of a lack expertise and technology in the management of a cancer surgery in Malaysia. Actually, in early 2000, I take a challenge to learn more about this problem and learn more about surgery to save limbs without an amputation and proper treatment cancer, which is important to cure this group of unlucky patient. Actually, Alhamdulillah, our treatment of cancer in Malaysia nowadays, as far as a cancer center in the world, we are able to salvage a patient life, and we can achieve good surgery, and then subsequently patient have a good function with new technology as well as a new proper management of a cancer. Practice and management of medicine and surgery is beyond hospital care. I'm lucky that I joined university as a young lecturer and then subsequently can practice orthopedic surgery as well as a cancer surgery in University Science Malaysia. There is more time for me to write, so I wrote two Malaysian Bahasa Malaysia book under Dewan Bahasa Pustaka with the aim to educate our local people in cancer as well as in trauma, doing research, international collaboration with other centers in the world, and meet other people sharing knowledge and sometimes the new innovation to improve patient care that also makes team easy for a patient. In general, early phase of my career is to learn new technology as well as new surgical technique to refine the best treatment for cancer patient as well as advanced trauma management. So this really will benefit local patients and improve their outcome as well as a function. Subsequently, once USM established and my unit is established as a leading center in the cancer treatment, so I travel to share the idea, collaboration and research, as well as teaching to a young generation in this region. And then subsequently, after 30 years of service, while preparing this talk, I noticed that I travel almost the whole entire globe. The whole focus is mainly about refinements of surgery, teaching the new generations for better treatment of a cancer patient, local education, and become a center for subspecialty training for cancer surgery in this region, Asian country, as well as Asia country. We have a quite number of doctor or surgeons from Indonesia, India, other Asian country that attach under us in Kubang Krian to become a future cancer surgeon. And this is a few photos of collaboration or teaching of a cancer surgery in USM. After completed my journey of a public servant for 30 years, Then I concentrate more on teaching, mainly local or international, especially in cancer surgery and major trauma problem. Writing guideline as well as cancer treatment, collaborate with international groups of people worldwide. And I do also arrange donation from corporate to the hospital for the patient needs, especially poor patients. And which is very interesting that I have spent more time for medical mission. So early of this year, I went to Africa for 2 weeks to teach cancer surgery in Africa for Doctors for Africa. And 3 months ago, I spent 2 weeks in Gaza for treating a war victims in Palestine, Gaza. Thank you very much. This is my short experience as medical doctors, orthopedic surgeons, orthopedic cancer surgeons, and this is a very interesting career. And as quoted, that medicine is more than a career, it is a love for humanity. Thank you.